Hey, Grandpa Paul here. This is a home visit for my granddaughter who you guys have seen before. She just had tongue tie surgery like 2 days ago, maybe 3. So just want to check in on her, see how she's doing, and maybe we'll chat a little bit about tongue tie. Hello. Hi. How you doing?
Good, how are you?
Oh, doing great. So good to see you. I'm
You
gonna take
too.
my shoes
Hello.
off. It's kind of muddy out there. Oh, she's awake. Hi. Hi, Liv. Oh my goodness. You're so beautiful. Oh. Oh. Hi.
She wakes up very calm.
Always?
Usually. Almost always.
This is a soothing environment.
Yeah, it is. It's nice. Not the environment I raised my kids in.
Sound machine,
We
blackout
didn't-
curtains.
We didn't have any of that stuff. Oh my goodness.
Space heater.
Yeah, it's warm in here.
Yeah. Well, they talk about the 4th trimester, like you're supposed to kind of recreate the womb for the first few months, and that keeps them calm and soothed
Yeah.
and sleeping well.
Yeah. You're just missing the heartbeat.
Yeah, it's an option on the sound
Oh, it
machine.
is an option?
Yeah.
Because they heard that heartbeat in the womb.
Yeah.
So I've heard that can... Are you looking at the camera? Is that what you're trying to do? I'm trying to see if your head will go the other way. Yeah, it will. There we go. It does. There's your mama.
Hi, sweetie.
Hi. So I'll let you ease her into the world of light.
The outside world.
Yeah.
Yeah.
Okay.
We'll do a quick diaper change and come out.
Okay. Sounds good. The nice thing about being a grandpa, though, is you don't have to do all the work.
True.
So parents, if you're a new parent, you know, or if you've been one, little babies are 24/7.
Mm-hmm.
Yeah. A lot of labor involved in feeding and cleaning and nurturing. And there we are. Oh, so cute. Hi. Hi. It's like still getting adjusted to the light, I think. Yeah. Oh my gosh.
Bruising around her eyes is going down.
It is
Yeah.
going down?
Mhm.
Okay. Okay, that might have just been bruising then. We'll see. We'll see. I'm still suspicious there might be
Birthmarking?
might be a
Really?
little birthmark. We'll see though.
Yeah, she's got one in between her lip and her nose too. That's,
Yep. So, actually, tell me about the surgery. How did that go?
Well, I mean, it went well.
Yeah. So let me introduce to our viewers that Liv is 3 weeks old.
3 weeks old.
Yeah, and 2 days ago, or was it 3 days?
Wednesday, so
2 days ago.
yeah.
So 2 days ago, went to one of the world's leading ears, nose, and throat doctors, who is an expert at the tongue tie procedure. In fact, I shadowed him for a half a day years ago, and he is good, and he's written articles on this, Dr. Gahary. And so take it from there. You guys went in and tell us
Yeah.
what he said, what happened.
So we went in for a consult, and the consult was set up so that she could get the procedure done that day if it seemed like it was necessary. And so he evaluated her tongue tie and her latch, and said that she would benefit from the procedure, that we had the option to do a partial release or a full release. So
Okay.
the partial release, he said, could improve the latch, but that would be about it. And with that option, we wouldn't have to do any of the stretches or exercises afterward.
Oh, is that the one you did?
No. So the full release would be what would have benefited reflux, gassiness, milk intake, and latch. But that one we had to do all of the stretches and exercises afterward for 3 weeks. And then the 4th week we taper them off. So that's what we chose to do, because he said a lot of the time people will get the partial release and then come back for the full. So so we went for it. She handled it well. She latched afterward immediately.
Can you explain what's involved in the procedure?
I didn't actually get to see it because it's a laser. He said that there are regulations about letting parents in the procedure room.
So right under the tongue, he takes a little,
Like a
you
laser
can kinda see a
pen.
raw part in the middle, sort of. It's already healing quite well. Yeah, it's way more healed than I expected in just 2 days. I'm not gonna turn her head this way. She likes looking that direction.
Well, she's also ready to eat. So
Yeah, it's like, where's my mommy? But they do a little laser unzip under the tongue. If you look at my hand here as the tongue, there's the frenulum that goes this way, which can be just snipped. But then tongues are supposed to be attached about here, so the tongue can move out of your mouth. When you're attached here, you can barely get your tongue past your lips because it just can't move. It's attached. So they take that little laser and they just go. Literally takes them about 10 seconds.
Oh, wow.
And it will leave a diamond-shaped opening. If you imagine you're unzipping, like if we were just to cut the skin here, it's going to spread open anyway. But there's so much pressure under that tongue that it creates this diamond. Did you see that somewhat afterwards?
We see it because we do the stretches. We
Yeah.
have to hold her mouth open and pull her tongue up to make sure that it doesn't reattach.
Yeah.
So we see it
Yeah.
6 times a day.
6 times a day?
Yeah.
Are you going to be able to do one on camera?
Sure.
Okay, that'd be
Yeah.
awesome.
Yeah,
That'd be awesome.
due pretty soon. We have to do it about every 4 hours.
Okay.
So
You do it before or after feeding?
I usually do it before.
Before? Oh,
Yeah.
perfect then. So when the time is right.
Yeah.
Do you remember what you were saying?
Yeah. So so we weren't allowed to go into the treatment room because of the laser restrictions, but she was only out of our sight for maybe 2 to 3 minutes.
Oh my goodness.
Yeah.
Yeah,
It's fast.
It's very fast.
They walk down the hall.
Yeah.
They're all set up.
They're all ready to go.
Yeah.
Yeah.
They put the numbing medicine on. That's what takes time.
Yeah, he put the Emla cream on actually in the exam room
Oh, okay.
beforehand.
So that's a new. So that
Yeah.
makes it quicker. Oh, he's figured his thing out. Because when I was there, we would take him and then put the cream and have to wait for it, then do the quick procedure. But if you've already got it numb, you walk
Yeah.
back, zzz, you come back.
Yeah, and then we
Yeah.
just hung out in the treatment room and nursed for a while and let her calm down before we went back home. And
Yeah.
I mean, she was very upset about 4 to 6 hours later. We did have to give her some Tylenol to get her to eat.
And the main reason you guys elected to do this is specifically because...
So there was a multitude of reasons actually. Even though she does have she did have a fairly good latch for being tongue tied, and we could get a good feed at times. What was happening was she couldn't always get a good feed unless it was like the ideal situation. So she would take about an hour to eat.
Oh, wow.
And
What's
then-
normal? Normal.
15 to 30 minutes.
Yeah.
So then what would happen is because you have to feed baby every 2 to 3 hours, by the time we would finish a feed, she was hungry again 30 to 60 minutes later.
Which must have been really tough
So
on
she wouldn't
you
sleep
guys,
enough
too.
in between. She was hungry before my milk would come back in.
You were working hard.
We were working really hard to get her
Yeah.
fed.
Because you had good weight gain, which is why I
We
was
had good
thinking.
weight gain,
I
yeah.
was thinking you were doing so well.
Yeah,
but,
and
but I didn't quite appreciate how often you were feeding.
we were feeding constantly.
Yeah.
Yeah. And then she wasn't extracting enough milk for me to start producing.
Oh, it's going to be
So-
time to do that massage since you're going to be fussing anyway.
Yeah, I know.
She's getting surprisingly.
Yeah.
She's not. I think she's also in less pain. We've been giving her Arnica
Oh, okay.
every 4 hours to.
Is it a topical thing or oral?
It's they're little pellets that just dissolve on our tongue.
Yeah. Okay. Oh. So there's the big jug of coconut oil. This is the torture chamber. Okay.
I know, sweetie. I'm sorry.
Well, at least you got pink gloves.
Well, yeah. The gloves are not necessary, but I think it does make it easier to just kind of glide over the skin.
Already knows what's coming.
Oh. Does it help if I'm holding the head or just go?
I have to stand in this spot
Gotcha,
actually.
gotcha.
So they say to kind of hold her head with your forehead,
Right.
forehead with the thumbs, chin with the middle fingers, and then index fingers go under the tongue. And she always closes on me, but I can still usually get it in there. Fine. Okay, one more spot, baby. One more spot. I know,
You're on either side of that
Yep.
middle. You don't go on the middle. itself?
The middle itself, you just gently glide over with your finger, which was hard to see because I did that without really holding her
Okay.
mouth super open.
Right.
But then you put more pressure on the muscle on either side.
Gotcha.
And that's it.
This is like fascia release.
I suppose you could call that. It's
Scar
there's
tissue?
There's a scar, right?
A swaddle blanket.
There's a wound, and if you allow that wound just to heal naturally, it will come together. And now you've got a scar where before you just had an attachment. But a scar is almost stronger in a way. You know how scars kind of are heaped up?
Right.
So it's to try to avoid a loss of the whole benefit, right? If it scars back down to where it was before, you don't have any benefit from the procedure.
Or it can get worse.
It can. Yeah, it can attach even in a way more tightly. Harder to then stretch it.
How long will you guys have to do this?
So we have to do that 6 times a day for 3 weeks.
Okay.
6 times in 24 hours. And then on the 4th week, we take 1 session off each day. So a total of 4 weeks.
Are you guys emotionally triggered by her crying? Or are you fine?
It was worse in the beginning when she when it was painful for her to eat. That's when it was really bad for me. But now she was mostly that upset just because she's also hungry.
She's your shirt.
Yeah, she's trying to latch onto my shirt.
Well, folks, you got a glimpse into another beautiful baby. This one's my granddaughter, and tongue tie, which is usually done when it's severe, super severe. You do it because no amount of passive stretching is going to solve a severe tongue tie, and it's going to help down the road a lot of things, but initially the feeding is key. So a lot of times that's why you're doing it, and that was their rationale too. I had not appreciated how difficult it was to get the volume in needed to grow, because when I saw her, she'd gained weight nicely, so I'm going, yay! But you see, that's the problem with having a grandpa try to pretend like he's a doctor anymore, because I didn't get all the details like I probably would have done if I was doing a clinical visit. I was just sort of like, my grandbaby. And so, yes, tongue tie can be extremely helpful for latch issues where the latch is just not being effective, or if it's painful. So those are a couple indications. And then some severe tongue ties might affect the growth of the whole shape of the palate. Speech issues are rare, but they can happen. And I have seen great success and very few challenges with it. I'm not saying it's a zero chance of any issues with the tongue tie. Mostly it's just it reattaches, and then it's like, darn, we're right back where we started and we went through a procedure. But usually it's very helpful. Thanks for watching. Dr. Paul here. I'm just sharing information. Remember, I don't diagnose or treat, but I love you anyway. So hopefully you're going to show lots of love to my daughter and my son, and let's get a lot of likes and thumbs ups, and let's interact about this. They were kind enough to let us into their home during a time when, you're trying to like stay put and not get exposed to anything out in the world. And they've blessed us with learning a lot. So thank you.